to Bloom. COVID-19 has presented many challenges, especially for the Hispanic community. A local not-for-profit hospice is providing resources to Hispanic families in Tampa Bay affected by loss or sickness during these challenging times with COVID-19. And joining us is Maria Pepe, who is this Hispanic community partnership specialist with Empath Health. Welcome to Bloom, Maria.
Thank you, Gail. Thank you for this opportunity.
Oh, and you have given such a great opportunity to so many people. I know that Latinos and other people of color are at a disadvantage, but you are here with information about resources available in our community.
Yes, and those numbers pointing at race and ethnicity are really an unfortunate reality. But in Empath Health, we know knowledge is power. So Empath Health had been providing a lot of educational sessions throughout many years to the Hispanic Latinx community. But during COVID, what we decided was to partner also with organizations in the community that already serve Latinos. So in addition of having our information in our website in English and Spanish, we have hosted with these organizations informational seminars virtually with our Spanish-speaking physicians in order to educate the community about COVID-19, the differences between COVID and the flu, as well as educating people on prevention. In our most recent interactive virtual seminar, our Dr. Jasmine Jerez Marte had a long conversation, very intimate, very candid, and very engaging with the Hispanic community about the COVID-19 vaccine.
That's really nice because, you know, there's been a lot of information on the news and social media and here and there, but you almost need to hear it in a more a candid, like you say, a real talk where people can understand, you know, because there's so much information out there. And I understand also that Empath approaches this for the whole family and the caregivers as well.
Yes. So we have support groups for caregivers as well as a lot of material. But when we started creating these support groups for caregivers, we needed to consider a lot of cultural aspects. The reality is that Hispanics don't really identify with the word caregiver, whether it's translated or not. They see themselves as family, so they do what families should do. I'm the wife, I'm the spouse. So we needed to embrace that reality, but also let them know how important their role is for the well-being of the person they care. So we have these support groups and they're powerful. People really support each other. They learn from each other. But you know what I love? They hold each other accountable when it comes to setting self-care goals so they can be at their healthiest self in this journey.
Yeah, that's really great because a community approach is so healing. And I know that the Hispanic community has also gone through a lot of loss, and you're there to serve those who are, you know, the survivors and they've lost their loved ones.
Yes. So if someone was in hospice care, they automatically they're served for 13 months after someone's passing for bereavement support. But whether they were served by Suncoast Hospice or not, we offer support groups in Spanish for grief, bereavement support groups. So I'm happy to announce that in addition to a virtual support group, we're going to have in-person support groups again, following CDC guidelines. And you know, one of the things that may affect the way Hispanics or Latinos grieve is the stereotype that we're strong and resilient and happy people. Well, support groups create like that sacred and safe space for people to express all kinds of emotions, whether it's anger, sadness, and many caregivers or families have shared with us how crucial it was participating in a support group for their grief, bereavement, in their journey of healing.
Well, I have to say, you know, with the passing of both my parents, you know, hospice stepped in.
Sorry.
Thank you and helped me, and they really were there for the emotional side of it. People don't realize that you are going through it and you go through this wave of emotions, and it was so comforting to have somebody there that doesn't judge you, that understands you and kind of can walk you through it. So we really do appreciate all that you all do, and for more information you can visit empathhealth.org. Thank you so much, Maria.
Thank you, Gail. Thank you for this.